I'd love to hear a little bit about what your study found, how you did your analysis, and sort of how we can all prevent this complication happening in our patients.
I think that, as retina surgeons, retina physicians, we all struggle, with that patient who presumably has been doing well for a long period of time and, comes back, to clinic, acutely, typically with, a significant vision loss. And, there's a large hemorrhage in our AMD patients. And so, through that line of thinking, my team and we kind of utilized, a big database called Vestrum. Vestrum is something I've worked with for a few years now, and they actually do a really good job of kind of collating, really, really good data. And, one upside of Vestrum is you can, utilize both ICD and CPT codes as well as, free text searching. And so we felt like we had a pretty good, and trustworthy population of AMD patients, but also, accurate, representation of submacular hemorrhages and injection types. And just kind of asked it the question, are what kind of patients are getting these hemorrhages? What drugs are maybe associated with these hemorrhages? What agents and like anti-VEGF agents are associated with more or less, frequent hemorrhage rates? And then, known risk factors that we all see, patients who are antiplatelets, anticoagulants, volume of injections, timing of injections, frequency, and disease duration. And looked at every single one of those metrics, including agent and your basic kind of demographic risk factors, and kind of plugged it into a multivariate model